Welcome back, everyone! In our previous lesson, we discussed one of the neglected non-communicable diseases, N-NCDs, and their unique challenges for healthcare providers. Today, we dive deeper into a critical aspect of managing N-NCDs, adverse drug reaction, ADR, reporting for medications used in their treatment. I'm your instructor, and by the end of this lesson, you'll understand why ADR reporting is crucial for patient safety and global health initiatives. Let's start by refreshing our knowledge of N-NCDs. Neglected non-communicable diseases, N-NCDs, refer to a group of chronic medical conditions that do not receive adequate attention and resources compared to other non-communicable diseases. N-NCD encompass a wide range of health conditions that are typically characterized by long-term progression, often leading to significant disability and premature death if left untreated. Here are some common examples of neglected non-communicable diseases. A. Chronic respiratory diseases, like chronic obstructive pulmonary disease, asthma, and interstitial lung diseases. B. Cardiovascular diseases, like rheumatic heart disease, pulmonary hypertension, and peripheral arterial disease. C. Mental health conditions, like schizophrenia, bipolar disorder, and major depressive disorder. D. Diabetes and metabolic disorders, like type 2 diabetes, obesity-related metabolic syndrome, and lipid disorders. Managing neglected non-communicable diseases poses unique challenges that hinder effective healthcare delivery and overall disease control. Let's explore some of these challenges. Limited awareness and education. N-NCD often receive less public awareness and education than other high-profile health issues, leading to delayed diagnosis and inadequate understanding of these conditions among patients and healthcare providers. Insufficient healthcare infrastructure. Healthcare systems in many regions may lack the necessary infrastructure, facilities, and resources to effectively manage N-NCDs. This inadequacy hinders access to essential medications and specialized care for patients with these conditions. Inadequate research and development. N-NCD have historically received less attention from the pharmaceutical industry, leading to limited research and development efforts for new and improved medications. As a result, treatment options may be limited or outdated. Stigma and social barriers. Stigma surrounding mental health conditions and certain N-NCD can deter patients from seeking medical help and discourage open discussions about their health. Social barriers may prevent individuals from accessing care and adhering to treatment plans. Economic constraints. Many patients with N-NCD come from low-income or marginalized populations, making access to healthcare services and medications financially challenging. The cost of long-term management can be prohibitive for both patients and healthcare systems. And lack of integrated care. N-NCD management often requires a multidisciplinary approach involving various healthcare providers. However, there may be a lack of integration and coordination among different healthcare services, leading to fragmented care for patients. Understanding neglected non-communicable diseases is essential for healthcare providers as they play a crucial role in raising awareness, promoting early diagnosis, and ensuring appropriate management. By addressing the challenges associated with N-NCDs, we can improve patient outcomes and contribute to global efforts in combating these often overlooked chronic conditions. Now let's explore why ADR reporting is so vital in the context of N-NCD medications. Importance of ADR reporting in N-NCDs. ADR reporting for N-NCD medications is essential due to the long-term nature of these conditions and the need for ongoing treatment. Patients may experience adverse reactions that could impact their quality of life and adherence to treatment plans. By reporting ADR, healthcare providers can better understand the safety profile of these medications and make informed decisions about their use. ADR reporting not only benefits individual patients, but also has a broader impact on public health. By collecting data on medication safety, regulatory authorities can take necessary actions to protect patients. Additionally, global health initiatives can benefit from this data, enabling better management strategies for N-NCD worldwide. Let's move on to explore some common adverse drug reactions associated with N-NCD medications, specifically those used for chronic respiratory diseases, cardiovascular diseases, mental health conditions, and diabetes and metabolic disorders. Common ADR with N-NCD medications. A. Medications for chronic respiratory diseases. 1. Bronchodilators. These medications, such as beta agonists and anticholinergics, are commonly used to treat chronic respiratory diseases like asthma and chronic obstructive pulmonary disease, COPD. Common ADR may include tremors. Some patients may experience hand tremors or shakiness after using bronchodilators. Tachycardia. Increased heart rate may occur as a side effect of these medications. Respiratory discomfort. In some cases, bronchodilators can cause irritation or discomfort in the respiratory tract. 2. Inhaled corticosteroids. Inhaled corticosteroids are used to reduce airway inflammation and are often prescribed for asthma and COPD-20. Common ADR may include oral candidiasis, also known as thrush. This condition can occur when corticosteroids affect the balance of oral microorganisms. Hoarseness. Inhaled corticosteroids can cause hoarseness or changes in voice quality. B. Medications for cardiovascular diseases. 1. Antihypertensives. Antihypertensive medications are used to lower blood pressure and manage cardiovascular diseases like hypertension. Common ADR may include dizziness. Some patients may experience dizziness or lightheadedness, especially when standing up quickly. Hypotension. Antihypertensives can cause low blood pressure, leading to symptoms like weakness and fatigue. Dry cough. Certain antihypertensive medications, such as angiotensin-converting enzyme, ACE, inhibitors, can trigger a persistent dry cough in some individuals. 2. Antiplatelet agents. Antiplatelet medications like aspirin are commonly used to prevent blood clot formation in patients with cardiovascular diseases. Common ADR may include bleeding complications. Antiplatelet agents can increase the risk of bleeding, especially if the patient has a history of bleeding disorders. C. Medications for mental health conditions. 1. Antidepressants. Antidepressant medications are used to manage various mental health conditions, including depression and anxiety. Common ADR may include nausea. Some patients may experience nausea or stomach discomfort when starting or adjusting the dosage of antidepressants. Insomnia. Antidepressants can sometimes disrupt sleep patterns, leading to difficulty falling asleep or staying asleep. Sexual dysfunction. Certain antidepressants may cause sexual side effects, such as decreased libido or difficulty achieving orgasm. 2. Antipsychotics. Antipsychotic medications are prescribed for conditions like schizophrenia and bipolar disorder. Common ADR may include weight gain. Some antipsychotics are associated with weight gain and metabolic changes. Extrapyramidal symptoms. These are movement disorders that can occur as a side effect of antipsychotic medications. Metabolic disturbances. Antipsychotics can lead to changes in blood sugar levels and lipid profiles. D. Medications for diabetes and metabolic disorders. 1. Oral antidiabetic agents. These medications are used to manage diabetes mellitus and help control blood glucose levels. Common ADR may include gastrointestinal disturbances. Some patients may experience digestive issues such as nausea, vomiting, or diarrhea. Hypoglycemia. Oral antidiabetic agents can lower blood sugar levels, and if the dosage is not adjusted correctly, it may lead to hypoglycemia. 2. Insulin. Insulin therapy is essential for patients with diabetes who cannot produce enough insulin 26. Common ADR may include hypoglycemia. if the insulin dosage is not appropriately adjusted, it can lead to low blood sugar levels. Injection site reactions. Some patients may experience redness, swelling, or itching at the injection site. It's important to note that individual responses to medications can vary, and not all patients will experience these adverse reactions. Healthcare providers should carefully monitor patients on N-NCD medications and address any ADR promptly to ensure safe and effective treatment. Additionally, patients should be educated about potential ADR and encouraged to report any new or concerning symptoms to their healthcare providers. Let's delve into some real-life case studies to see the impact of ADR reporting in the context of N-NCD medications. Mr. Johnson, a 58-year-old male, diagnosed with moderate to severe asthma, has been using an inhaled corticosteroid and a long-acting beta-agonist combination inhaler for asthma management. Adverse drug reaction. Mr. Johnson visits his healthcare provider complaining of oral discomfort and a persistent sore throat. Upon examination, the healthcare provider observes white patches on Mr. Johnson's tongue and inner cheeks. These findings indicate possible oral candidiasis, which is a known adverse effect of inhaled corticosteroids. ADR reporting and management. The healthcare provider documents the adverse reaction and discontinues the ICS temporarily. Mr. Johnson is prescribed an antifungal oral rinse to treat the oral candidiasis. The healthcare provider reports the ADR to the pharmacovigilance system, ensuring that such adverse effects are closely monitored and that patients using inhaled corticosteroids are educated about the risk of oral candidiasis. Mrs. Window, a 60-year-old female, has a history of hypertension and is on antihypertensive medication, an angiotensin-converting enzyme inhibitor, to manage her blood pressure. Adverse drug reaction. Mrs. Window visits the emergency department with complaints of a persistent dry cough and weakness. Upon evaluation, it is determined that Mrs. Window's symptoms are likely due to the ACE inhibitor she is taking. ADR reporting and management. The attending healthcare provider documents the ADR and switches Mrs. Window to an alternative antihypertensive medication. The patient's symptoms improve after the switch, confirming the causative relationship between the ACE inhibitor and the dry cough. The healthcare provider reports the ADR to the pharmacovigilance system to raise awareness among other healthcare professionals about the potential side effect of ACE inhibitors. Ms. Sasha, a 42-year-old female, has a history of generalized anxiety disorder. She has been taking an antidepressant medication, selective serotonin reuptake inhibitor, for the past 6 months. Adverse drug reaction. Ms. Sasha visits her psychiatrist, reporting a significant decrease in libido and difficulties in achieving orgasm. Upon further assessment, the psychiatrist determines that these sexual side effects are likely associated with the use of the SRI. ADR reporting and management. The psychiatrist records the ADR in Ms. Sasha's medical file and discusses the possibility of adjusting the dosage or trying an alternative medication with fewer sexual side effects. The ADR is also reported to the pharmacovigilance system to contribute to the understanding of psychotropic medication-related sexual dysfunction. Mr. Nathan, a 62-year-old male, has been managing type 2 diabetes with oral antidiabetic medication, metformin, for the past 3 years. Adverse drug reaction. Mr. Nathan presents to his primary care physician complaining of dizziness, sweating, and confusion. After blood glucose monitoring, it was revealed that Mr. Nathan's blood sugar level had dropped significantly, indicating hypoglycemia, a potential side effect of metformin. ADR reporting and management. The primary care physician immediately addresses the hypoglycemia by administering glucose to raise Mr. Nathan's blood sugar levels. The medication dosage is adjusted, and Mr. Nathan is advised to closely monitor his blood glucose levels. The ADR is reported to the pharmacovigilance system to alert other healthcare providers about the potential risk of hypoglycemia with metformin use. These case studies highlight the importance of ADR reporting in N-NCD management. Timely identification and reporting of adverse drug reactions enable healthcare providers to take appropriate actions to ensure patient safety and optimize treatment outcomes. A robust pharmacovigilance system aids in identifying patterns of ADR associated with specific medications, leading to improved drug safety profiles and better patient care. By sharing these experiences and reporting ADR, healthcare professionals in Kenya contribute to global health initiatives and enhance the overall quality of healthcare for patients with N-NCDs.
Having seen the impact of ADR reporting, let's now discuss some best practices to ensure effective reporting for medications used in N-NCDs. Raising awareness among healthcare providers. Raising awareness among healthcare providers about the importance of ADR reporting is crucial. Proper education and training enable them to accurately identify and report potential adverse reactions. Encouraging patient participation in ADR reporting. Encouraging patients to participate in ADR reporting empowers them to take an active role in their healthcare journey. Healthcare providers must create a safe and supportive environment for patients to share their experiences. Collaborating with global pharmacovigilance networks. Collaboration with global pharmacovigilance networks allows for the sharing of valuable data on medication safety. This collective effort contributes to the improvement of N-NCDs management on a global scale.
Lastly, let's explore the broader role of pharmacovigilance in improving N-NCD management and its significance in public health efforts. N-NCD management and drug safety monitoring. Tailoring treatment plans. Pharmacovigilance data can inform healthcare providers about individual patient responses to specific N-NCD medications. This enables personalized treatment plans, considering factors such as comorbidities and patient characteristics. Minimizing drug interactions. Patients with N-NCD may be on multiple medications simultaneously. Pharmacovigilance helps identify potential drug interactions, reducing the risk of adverse events and treatment complications. Long-term safety assessment. Many N-NCD medications require long-term use. Pharmacovigilance ensures continuous monitoring of safety profiles, even after drugs have been on the market for an extended period. Monitoring vulnerable populations. Vulnerable populations, such as the elderly or pregnant women, may have unique safety concerns. Pharmacovigilance data allows for specific monitoring of these groups to ensure their safety. Collaboration with healthcare providers. Pharmacovigilance involves active collaboration with healthcare providers to foster a culture of safety and reporting. Regular communication and feedback loops ensure that ADR reporting becomes integral to clinical practice. Pharmacovigilance is pivotal in improving N-NCD management by providing valuable insights into the safety and efficacy of medications used in their treatment. By detecting and assessing adverse drug reactions, pharmacovigilance contributes to patient safety, informs healthcare policies, and supports public health initiatives in Kenya. N-NCDs, although often overlooked, significantly impact the well-being of individuals and communities. Through comprehensive pharmacovigilance efforts, healthcare stakeholders in Kenya can ensure that N-NCD medications are safe and effective and contribute to better health outcomes for the population. By understanding the role of pharmacovigilance in N-NCD management and implementing best practices for ADR reporting, Kenya can make significant strides in addressing the burden of N-NCD and improving the overall quality of healthcare in the country. Thank you for actively participating in this lesson on ADR reporting for N-NCD medications. In the next lesson, we will explore identifying and reporting adverse events in endemic communicable diseases in Kenya, TB, HIV, AIDS, and malaria.